Hey guys, welcome to Dogshala. So today we are going to see about an important topic, that is typhoid fever. So a question was asked from typhoid fever in previous NEET MDS. So let's just see what is typhoid fever. We'll just give out a gist and then we'll see the question in the end. So do see the video completely to know what the question was. So typhoid fever. So as you know, typhoid fever is caused by Salmonella species. So the image here depicts the Salmonella species. Okay, so it is caused by Salmonella serotype typhi bacteria, especially Salmonella typhi and paratyphi, representing the typhoid and paratyphoid fevers. Actually, typhoid and paratyphoid fever, both, if they are they both combinedly, they are called as enteric fever. Okay, it is an infection which spreads to contaminated food and water. So as you know, it spreads through contaminated food and water, right? Then what are the signs and symptoms? So the image here shows regular signs and symptoms, like a patient will present with irregular fever, headache, pain in abdomen, tiredness and weakness, muscle pain, loss of appetite, nausea and vomiting. But specific symptoms and specific stages are there in typhoid fever. So based on that stages, we identify the diagnosis. The diagnosis can be done for each stage separately, and based on the stage we are finding it, we can also treat it separately. So three distinct stages of typhoid fever are there. So they each last about 1 week. So we can classify the symptoms as first week symptoms, second week symptoms, and third week symptoms. Okay, so of course after these stages the patient becomes exhausted and emaciated. So let's just see what the first week stages are. So the first week symptoms are the body temperature rises slowly. The body temperature rises slowly. So this is called as step ladder pattern of fever. So this is very important. Step ladder pattern of fever is seen in typhoid fever. And they are seen with relative bradycardia, which is known as Faggot sign. So, Faggot sign. What is a Faggot sign? The Faggot sign, which is also known as spigmothermic dissociation, it is nothing but fever plus bradycardia. That is relative bradycardia. Okay, so it is seen in yellow fever, typhoid fever, tularemia, brucellosis, Colorado tick fever, Legionella pneumonia, and Mycoplasma pneumonia. These are some of the examples, but there are other examples also which show phagic fever, but I have just listed a few here. And along with that, during the first week, patient will experience malaise, cough, and headache. Along with that, epistaxis might also be seen in few, and abdominal pain. So abdominal pain is also seen. Leukopenia with eosinopenia and relative lymphocytosis, and blood cultures during the first week is positive for Salmonella enterica subspecies Enterica cerovera typhi. So for this subtype and subspecies, the blood culture will get it as positive, whereas the viral test is usually negative during the first week of typhoid fever. Okay, so these are the first week symptoms. So let's go for second week. Second week of symptoms. So as you can see here, the image, it is showing rash. Rather than rash, it is like a spot. So this rash, first of all, starts as a spot, then becomes a rash. Okay, it then progresses into rash. So let's just see what the symptoms during the second week. The person is often tired to get up with high fever in plateau around 40 degrees Celsius, and bradycardia, same, faded sinus same, classically with a dichotic pulse wave. Okay, delirium can occur. Delirium, that is, person is seen to be disoriented with the surroundings, and he might have a agitation. So, okay, agitation. sometimes he might be calm, sometimes he might be agitated. So hence this typhoid fever during second week is given a nickname as nervous fever. Then coming to rose spots, as we can see in this image, they appear in the lower chest and abdomen in around one third of a patient. Ronchi is nothing but rattling breath sounds. Rattling breath sounds are heard at the base of the lungs. This is also an important sign. The abdomen is distended and painful in the right lower quadrant, whereas rumbling sound can be heard, where a rumbling sound can be heard in the abdomen. Then diarrhea can occur in the stage, but constipation is also common. So first week we didn't see any diarrhea. We have only seen abdomen, but as the disease progresses into the second week, we can see diarrhea along with constipation. Then hepatosplenomegaly and liver transaminases are elevated. Hepatosplenomegaly, that is nothing but liver and spleen both get enlarged, and liver transaminases are elevated. Here in second week, the viral test is strongly positive with anti-O and anti-H antibodies, and blood cultures are sometimes still positive. Okay, blood cultures is sometimes still positive. Why we are saying blood culture still positive? It is like because as the disease progresses, we don't depend on blood culture alone for the diagnosis of the disease. Okay, so initially when the symptoms start, we can identify it as a typhoid fever with blood culture alone. But as the symptoms progress, we add different kind of tests to identify. So based on that test only, we can say the patient on which stage he is in. Okay. Next. So this is second week. Then coming to the third week. So third week, this is the final week of typhoid. So the fever is still high. It oscillates very, very little over 24 hours. Dehydration along with malnutrition, since diarrhea is there, dehydration occurs since malnutrition. After that, a patient will not eat anything because of that. So malnutrition, and the patient is still delirious. A third of effect will affect with macular rash. Thus, raw spots, because of this raw spots, the patient will be having itching and everything. Because of it, it progresses into a rash kind of thing, but only in one third of population on the trunk region, especially macular rash on the trunk. Then intestinal hemorrhage due to bleeding in congested Peyer's patch. Peyer's patch are congested. By the time it progresses, the Peyer's patch in the intestines become congested. So intestinal perforation in the distal ileum is a very serious complication, and it is often fatal. It may occur without alarming symptoms until septicemia or diffuse peritonitis is seen. Okay, so without any symptoms, it may occur. So until septicemia or peritonitis is seen. Respiratory diseases such as pneumonia and acute bronchitis may be seen. Encephalitis, neuropsychiatric symptoms described as the muttering delirium or coma vigil with picking at bed cloths or imaginary objects can be seen. Metastatic disease, abscesses, cholecystitis, endocarditis, osteitis. Thrombocytopenia is sometimes seen. So these are the fatal symptoms which occur in the third week. Okay, when the patient reaches these stages, it is difficult to treat the patient. Okay, so then coming to the diagnosis. Diagnosis is made by, as we have seen from the previous slides, we have come to the conclusions that diagnosis is made by blood cultures. Along with that, we can use bone marrow cultures, we can use stool cultures, and along with that, vital test. So these are some important things. So blood, bone marrow, stool cultures, urine cultures, so and viral test. Actually, I think this is urine culture only. There is a mistake here. Okay, blood urine culture. So this is urine culture only. Okay, so the blood test The blood test is the diagnostic gold standard. So as we have seen, it is positive in the first week. So since it is positive in the first week, we can directly order the blood test for the patient. Then the sensitivity is 40 to 80%. When coming to the stool culture. The stool culture, it is taken in third week. It is effective in patients on antibiotics. Effective in patients, even those who are taking antibiotics, and those who show negative blood culture. Sometimes blood culture may show negative when the stage advances. So there we can order a stool culture. Then coming to urine culture is also positive only in second and third weeks. So apart from these, we have some latest rapid diagnostic tests such as TUBAX, Typhoid, and Testit. So it have shown moderate diagnostic accuracy, but rather than these, the uh, traditional methods of diagnosis are this one. Okay, blood, urine, stool, and vital test. Okay, so let's just see what. So let's just see what is a vital test now. Vital test. So the vital test is used to identify specific antibodies in the serum of people with typhoid by using antigen antibody interactions. So antigen it is used with by using anti-O and anti-H antibodies, right? So this is in this test the serum is mixed with the bacterial suspension of salmonella with specific antigens. If the patient's serum contains those antibodies, against those antigens, they get attached and form clumps. If clumping does not occur, the test is negative. So the viral test is time consuming and prone to significant false positives. So it is prone to significant false positives. That is why it alone doesn't, we don't take it as a single criteria to diagnose it as typhoid fever. So we take it along with other diagnostic test. So it may also be falsely negative. So in some recently infected people, it will show it as false negative. Okay. So that is why we don't take diagnostic test alone as a viral test alone as a diagnostic one. Okay. Then coming to the vaccinations that we have against typhoid. So when this is an this is only when the people come into contact with the food and water, but it is like epidemic to few areas. So when the people are traveling to these areas, the WHO has ordered them to undergo these vaccinations to protect themselves from typhoid. So the two typhoid vaccines are there. So they are one is live oral vaccine, that is type 21 A vaccine. It is sold as uh, Vivotif. It is sold as Vivotif. So as you can see in the image. So here in the image, you can see the tablets, right? So it is sold as Vivotif by Crucell Switzerland AG, and as injectable typhoid polysaccharide vaccine, it is sold as Typhoid by Sanofi Pasteur and Typhoid by and by GlaxoSmithKline. Okay, then coming to the treatment. So treatment, oral rehydration therapy is a must for any stage typhoid people, because the people will be going through dehydration and malnutrition. And along with that, antibiotics. So the antibiotic of choice where resistance is uncommon, where the patient is not having resistance to any of the antibiotics, the choice is fluoroquinolone, such as ciprofloxacin, or otherwise a third generation cephalosporin. Third generation cephalosporin such as ceftriaxone and cefotaxime are the first choice. Cefixime is a suitable alternative. So fluoroquinolone such as ciprofloxacin, or else third generation cephalosporins such as ceftriaxone and cefotaxime are the first choice. Then cefixime is a suitable oral alternative. This you have to remember. Ampicillin, chloramphenicol, trimethoprim, sulfamethoxazole, amoxicillin, and ciprofloxacin have been commonly used to treat it. Treatment with antibiotics reduces the case fatality rate to about 1%. As resistance to ampicillin, chloramphenicol, and streptomycin is nowadays common, these agents are no longer the first line treatment of typhoid fever. Okay, so ampicillin, chloramphenicol, trimethoprim, sulfamethoxazole, and streptomycin. These are some drugs which for which people have developed resistance. So hence they are not first line of treatment for typhoid. So typhoid resistant to these drugs is known as multi-drug resistant typhoid. Surgery is usually done if there is any intestinal perforation, or else surgery is not required. Coming to the question which is asked in NEET MDS 2023. So the question is a case-based question. They have seen like a 7-year-old male child reported to fever clinic. So he had step-ladder pattern of fever. Step-ladder pattern of fever is seen in first week of typhoid. Frequent stomach pain and vomiting for 5 days. Enteric fever was suspected. Okay, since it is a step-ladder, enteric fever is suspected, but he is having symptoms since 5 days. So the patient is reporting it as 5 days. Okay, it's not like we don't know exactly, right? So which of the following is the best in investigation that should be done immediately? So blood culture, stool culture, wild test, or urine culture. So as you all know, blood culture is the gold diagnostic for typhoid, right? So, so since it is the gold diagnostic, and the patient is reporting only for 5 days, so he might be in the first week only. So first of all, we have to take the blood culture. So this itself will come positive. Then we can give treatment with the antibiotics and cure the symptoms accordingly. Okay. If you like our video, do subscribe to our YouTube channel and do like it, share it to your friends and discuss it among yourselves about typhoid fever further. And you can also follow us on Instagram at Dogshala and at Dogshala Medical for further updates. And you can also find us on Telegram. Thank you.